Hello, and welcome to our Facebook Live Q&A. I'm Dr. Sarah Hallberg, and this is Dr. Brittany Volk. I am one of the medical directors here at Virta Health and also the primary investigator of our very large clinical trial looking at type 2 diabetes treatment.
I'm Dr. Brittany Volk, and I am a senior clinical and patient engagement specialist here at Virta, but my background here has been both in the clinical and research teams. Please list your questions in the comments below this video, and we will try to get to as many as we can.
As we answer questions today, please remember that this is not individual medical advice. Anything that we say here that is more general recommendations cannot replace the recommendations of your personal physician.
All right, let's get going. So, Dr. Hallberg, what are the metabolic benefits of a ketogenic diet?
Well, the metabolic benefits of a ketogenic diet are actually multiple things. So let's start from the beginning. Metabolic health, exactly what does that mean? Well, really it drives around something called insulin resistance. So insulin resistance is where your body truly becomes resistant to the function of insulin. Insulin has many jobs in our body, one of them being it is our fat storage hormone. But also, when we consume food that contains carbohydrates that turns to glucose in the blood, one of insulin's jobs is to essentially open doors to allow the glucose into cells that surround the blood vessels, therefore keeping blood sugar at a stable level. So when we talk about insulin resistance and insulin can't do that very important job of allowing glucose into cells to keep blood sugar normal, we become resistant to it. Insulin resistance. And so what a ketogenic diet does is it actually decreases what is causing the need for all that insulin. What causes the need? Let's go back to what I just said. And when you consume food that contains carbohydrates, those carbohydrates turn to glucose and need to be pushed into the cells surrounding the vessels where they can be used. So in other words, we're requiring insulin to do that. The more carbohydrates we eat, the more insulin we are requiring. So on a ketogenic diet, we're taking away the driver, creating the need for insulin. Less carbohydrates coming in, less need for insulin, and the longer that we do this, then the more sensitive we can become to insulin. So again, insulin resistance is a big function of metabolic health, and the ketogenic diet directly influences not just a symptom of metabolic health, but the root cause.
All right. Next question. So do ketone supplements work, and are they worth it?
Well, we actually are not 100% sure about whether ketone supplements will work in the realm of metabolic health. And so I definitely would recommend not to add these in. Many of them are going to add in carbs and calories that are for unclear benefits. So I think in reality, we're going to find a place for ketone supplements somewhere in the future, but I think it's going to be more focused on things like neurologic conditions and maybe cancer. As far as metabolic health goes, the ketones that we want you to have are ones that you're producing from your stored and ingested fat. And one of the questions, a very important one in fact, that we don't know the answer to is, if you're taking ketone supplements, then is there a chance you block your internal production of ketones? And that's a possibility, and that would really be counter to what we're trying to do here. So blanket quick answer is, I don't recommend ketone supplements.
Okay. All right. A little bit of a turn here. How do you fix diarrhea on a ketogenic diet?
Well, actually, diarrhea is usually not something that we see regularly on a ketogenic diet. But of course, everybody is different, and one of the main things with the Virta treatment is we want to personalize it for everyone. So if any particular person has diarrhea, a few things that I would recommend. take a look. Did you just change anything in particular with your intake? Did you start adding some artificial sweeteners such as xylitol? Were there other new foods that came in that you may be sensitive to? And one of the things may be to try a short period trial of elimination of some of those new foods to see if you can pinpoint a specific problem. Another thing that I would look at is magnesium. Are you supplementing with magnesium? And if so, which kind? Different magnesiums can have different effects on the GI system. Magnesium oxide, for example, can cause diarrhea in some people, whereas slow mag, the slow-released magnesium, doesn't tend to cause a problem here. So if you're taking one of the shorter-acting ones, another thing to consider is changing to the slow-release magnesium.
If you're just joining us, we want to welcome you to Virta's Facebook Live Q&A with Dr. Sarah Hallberg. Please put your questions in the comments under this video, and to be notified of future Facebook events, please follow Virta on Facebook. All right, what causes muscle cramps on a ketogenic diet, and how can I fix them?
Well, often muscle cramps are a sign of decreased magnesium. Can be decreased potassium too, but oftentimes the driver of that is low magnesium levels. Now, I will tell you, you hear talking about cramps on a ketogenic diet, but honestly, cramps are one of the most common conditions anyone comes into a primary care physician's office for. So they are universal, whether you're on a ketogenic diet or not. And they can be frustrating to people of all kinds. I mean, they can impact young athletes and they can impact people who are much older. So it is not a problem confined to anyone on a ketogenic diet. But if you are on one or not and having an issue with muscle cramps, magnesium is definitely the #1 thing that you want to do. So supplement. Our magnesium levels in our population are low, period. Again, this is not confined just to a ketogenic diet. Unfortunately, our soil has less magnesium in it these days, and so we're not getting as much naturally as we used to hundreds of years ago. So magnesium is a reasonable choice for many people to supplement with. And as I was talking about before with the diarrhea question, there's a couple of different ways that you can supplement with magnesium. There are the short-acting magnesium supplements, such as magnesium oxide, and there are the longer-acting magnesium supplements, such as slow mag. And again, short-acting can sometimes cause diarrhea or loose bowels, so it would be ideal for someone who maybe has struggled with constipation in the past. But if you're not having any issues with your bowels and want to keep it that way, slow mag is a good option as well. Now, besides magnesium, another potential problem is that you're not getting enough sodium. So again, especially early on when you're beginning a ketogenic lifestyle, it is fantastic to be making sure that you are getting enough sodium. How do you do that? I mean, we recommend increasing the salt in your food. We recommend bouillon a couple of times a day. Or if bouillon isn't something that you enjoy, or especially if it's the summer and really hot, pickles can also be used to just ensure that you're getting the sodium intake that you need.
And it might be helpful to mention too that most of our magnesium is stored within our cells, so when you do a blood test of magnesium, it may not appear that you are deficient in magnesium, but yet it still is one of the most common causes.
That's a really good point. And so a lot of times, even physicians will judge magnesium need based on a blood test. But the blood test does not look at magnesium intracellularly. So there's no good way to measure that. And magnesium is very difficult to truly overdose on. I always give people the example of when women go into preterm labor and they come into the hospital and they're trying to stop preterm labor, which of course is cramping, right, of the uterus. What do we give them? We give them mega doses of magnesium IV. And so, magnesium you can't gauge very well through a blood test. So if you're having cramps, take some and see if it improves your symptoms.
Cramps or twitches or Charlie horses or...
Yeah. The whole 9 yards, right? Because they can be problematic and always tend to occur worse at night. Right.
Yes. Okay, ready? Next question. How do I break a weight loss plateau on a ketogenic or low-carb diet?
That's a great question. And so let me go back to something that I use all the time, and that is that there's 3 things guaranteed in life: death, taxes, and a weight loss plateau. So sadly to say, you cannot avoid it. They will happen to everyone, and I would say pretty comfortably, they're universally frustrating. And so knowing that, what do you do when you're in one? Well, first I want to say, take a deep breath and relax, and begin with the question, is this really a weight loss plateau? Or am I getting concerned because I'm having day-to-day or even week-to-week variability on the scale? Because, you can weigh different one day to the next, and it may have absolutely nothing to do with your nutritional intake. Did you sleep poorly? Did you have a bad day at work yesterday? Did you get irritated with the kids? I mean, stress can have a direct impact, and exercise, believe it or not, can also impact that as well. So take a step back from the day-to-day measurements and take a look at what's going on in a longer period of time. And how long have you been, quote, stuck for? I think a reasonable definition, but let me be clear before I say this, there is no absolute definition of what is a weight loss plateau, but a reasonable guide may be something like no weight loss for 3 months with no idea of why that would be. So you just can't come up with an explanation. And so if that occurs, there's multiple things that you can do. Number 1, first ask, is there any health conditions that may be causing this? Is it allergy season and I'm in the midst of it bad? Is it that my thyroid could be off? Ensure that there's nothing like that going on. Number 2, ask yourself, did any medications change? Am I taking something that I wasn't before? Did another physician add a medication that may be causing a problem? Did I start taking anything over the counter? Or did I stop medications I was previously on? That's another big one as well. And again, looking at things like stress and sleep, are those changed? Has your schedule changed when you're eating? These are all things that can play a major role in a weight loss plateau. And of course, last but far from least, what does your nutrition look like? Now, one of the things that we find that can be pretty interesting to realize is that the better you get at understanding how to move forward with a low-carb lifestyle, the more at risk you get for carb creep. Because for people who really know what they're doing, what we tend to say, myself and Britt included, I know, is that looks like a half a cup of strawberries. And in reality, it's become a lot more. So I recommend 2 days of a really hard look at what you're eating. 2 days really going back to counting calories, really going back to those strict dietary changes that you were making when you first began. Is anything going on? Has anything that I can change occurred? And I want to really put one note of caution in here. When people hit a weight loss plateau, they tend to be so desperate to get out of it that they may fall victim of making changes that are not sustainable. So if you've had great success and find yourself in a plateau, I really caution people to tell them to resist making changes that they don't feel like they can sustain over the long haul. Remember, don't do anything in the short term that you can't sustain in the long term. That's a really important point when it comes to your food intake. And I'll also add one more thing to take a look at. Have you just started exercising or changed up your exercise routine? Because believe it or not, when people start to exercise, it can often cause a short-term weight plateau. This does not mean you should not be exercising. But it can be such a big factor for people that oftentimes when people are ready to begin exercise, which is fantastic and exciting, I actually would like to warn them, a short weight plateau can occur. Don't be frustrated, keep moving forward and pay attention for a little while, not so much the scale, but how those clothes fit.
And I think it's fair to say that when you've been losing significant weight, 1/2 pound to 2 pounds a week for months at a time, the body is healing tremendously and just needs that time to maybe play catch up. And we can't explain exactly the timeline, but it's normal.
It is, right? And the timeline can be frustrating. I always say to people, you know, if I could tell you the exact day the plateau would end, if I could say, all right, don't worry because, you know, January 2nd, it's really just the 2018. By the time 2019 rolls around, January 2nd, you're going to be out of this plateau. You know, everybody could really sit back and say, that's fine, I can get there. But the frustrating thing is we don't have that exact notion of when it's going to be over. And so it's just looking at the successes you've had in the past and continuing to plug forward.
Okay, is it safe to attempt a ketogenic diet while on SGLT2 inhibitors?
No. This is a really important issue, and I'm so glad for whoever asked this question. But SGLT2 inhibitors can cause diabetic ketoacidosis, even a very specific problem called euglycemic ketoacidosis. Usually when someone is in ketoacidosis, it's because their blood sugars are sky high. But euglycemic ketoacidosis, that is specifically caused by SGLT2 inhibitors, can occur with normal blood sugar. So it's actually even more difficult and therefore more dangerous because it's harder to diagnose. So anyone who is beginning to start on a ketogenic lifestyle needs to stop their SGLT2 inhibitor well before making dietary changes. And this is why it is so important not to do this without medical supervision if you're on any medications, because you should not be making these medication changes without the oversight of a physician. So an incredibly important topic, and one, again, I just want to state again and again, requires medical supervision.
Since we said diabetic ketoacidosis, we might want to just differentiate between nutritional ketosis and diabetic ketoacidosis.
Absolutely. Diabetic ketoacidosis historically has been a problem more often in patients with type 1 diabetes. It's actually really rare in someone with type 2 diabetes, but can happen. Truly, starting a ketogenic diet, we do not have people go into diabetic ketoacidosis. It is very rare from carbohydrate restriction. But combining carbohydrate restriction and an SGLT2 inhibitor increases the risk, and diabetic ketoacidosis is absolutely different from nutritional ketosis. Absolutely different. In nutritional ketosis, we want those ketones, but they are at an incredibly small degree compared with the state of diabetic ketoacidosis. We're talking well over 10 times different. So that nutritional ketosis state where our ketones are elevated is desired. Diabetic ketoacidosis, totally different. Very, very high ketones that can be dangerous.
Great, thanks. Okay, my blood sugar is really high after I wake up. What causes this and what can I do about it?
This is such a frustrating problem for patients with type 2 diabetes. And this really comes from longer standing type 2 diabetes. When we think of type 2 diabetes, right, we think of elevated blood sugar. Yes, that is definitely the main thing and the main problem with this disease. However, one of the other things that occurs that causes the elevated blood sugars is that our liver becomes less sensitive to the insulin. Remember earlier when I talked about insulin resistance, I said one of the main problems is that our body is resistant to insulin, therefore not allowing it to push glucose out of the vessels and into the cells like it's supposed to. Well, the very same thing happens in the liver. The liver becomes resistant to insulin as well. And And when insulin goes up, what's supposed to happen is that it's supposed to be a signal to the liver. Stop making glucose, right? And I'm going to pause there for just a minute because I think this is a really important point. And that is, some people say we have to have carbohydrates, right? We have to have carbohydrates in our diet. We can't function without them. Well, they're not. There is no essential carbohydrate. Essential is something that the body can't make itself. And our body can make plenty of glucose. And it does so in the liver, and it's called gluconeogenesis. Break that down. It's glucose new, right, being made. And that happens in the liver. And when insulin goes up, that is supposed to halt. But when the liver is resistant to the insulin, what can happen is the liver can start putting out glucose sort of unregulated. And this tends to happen much more during a fast, like when you're asleep. So overnight, the liver's putting out glucose, and when you get up, it starts to rise. The other reason it rises in the morning is that is the time of the day when our cortisol levels are high enough. And anyone with type 2 diabetes who's ever been on prednisone knows that these cause blood sugars to go up high. And cortisol is like our internally produced prednisone. So two big reasons blood sugars go up in the morning is that we have an unchecked liver production of glucose, number one. Number two is the rise in cortisol. So what can you do about it? And this is a really important time to start experimenting with what you eat before bed. Do you need a little protein before bed to keep the liver from putting out glucose? A little fat before bed? What can you do? And this is very personalized, so there's not one recommendation that can be applied for all. And the other thing is, this is a time to talk to your physician who is supervising your medications, because maybe some medications need to be changed to be taken in the evening, possibly instead of the morning, to help combat this issue as well.
All right. Is canola oil okay on a ketogenic diet? Some people say it's bad and some say it's good. So.
Well, I think one of the big issues, there are actually a few, with canola oil is one of the things that we want to say is sort of the foundation of a well-formulated ketogenic diet is it's a whole food diet. And there is not anything whole food about canola oil. And so we ask people to stay away from it as much as possible. I mean, really, you can Google like how canola oil is made, and it's a pretty, kind of disgusting process, actually. They bleach it, all these chemicals are put in, and so for that purpose alone, we say avoid it as much as possible. Now, that being said, there are going to be some times, especially when you're out to eat or somewhere where a dressing is going to have some canola oil in it, but we encourage people to rely on olive oil, which is simply pressed olives, as much as possible. The other thing is canola oil has a lot of what we call omega-6 fatty acids. And too many omega-6 fatty acids have been shown to increase inflammation, and the other thing is they can cause some nausea symptoms as well. So in place of canola oil, though you're going to get it sometimes in small amounts, we really do recommend looking towards some of those more monounsaturated fats, such as avocado or olive oil.
All right, if you're just joining us, we want to welcome you to Virta's Facebook Live Q&A with Dr. Sarah Hallberg. Please put your questions in the comments under this video. And to be notified of future Facebook Lives and other events, please follow us on Facebook.
Great.
All right. Is it normal to have high LDL-P and small LDL-P levels when on a ketogenic diet? How about inflammation?
So the answer to that is no. LDL-P levels in many people actually fall when starting a ketogenic diet. But once again, I'll go back to everybody's body is different. And so if you happen to have an elevated LDL-P level, a couple of things that I would say. Number one, have you checked your cholesterol levels or LDL-P levels while you're losing weight? You're rapidly losing weight. because sometimes during rapid weight loss, we can have a temporary rise in both LDLP and LDLC levels. And the reason for that is pretty simple. Where is your body's biggest store of cholesterol? It's actually in your fat cells. And if you're losing weight rapidly, you're mobilizing that fat like crazy. And so therefore, it's not that you're making more cholesterol, it's that you're mobilizing the body's stores of cholesterol. And that's why the rise is temporary. So if you see this rise happening while you're losing weight, a significant amount of weight, my advice in most cases, and again, this is why you need your individual physician's input, but in most cases, it's wait until your weight loss stabilizes and recheck again. But if you've done that already and your weight has stabilized and you still have elevated LDLP levels, then this is a discussion you need to have with your physician. My advice when I meet patients one-on-one about this is to take a look at all of their cardiovascular risks and ask themselves, why are they on the ketogenic diet? Has it really improved so many other facets of their health overall? And in those cases, more intense management of that LDLP level may be warranted. And let's go to the second part of that question, which was inflammation. And what we can say about inflammation is multiple studies, including ours, have shown a significant decrease in inflammatory markers with the start of a ketogenic diet. In fact, in our large study with type 2 diabetes, we actually saw a 40% reduction in something called C-reactive protein, which is an inflammatory marker directly linked to being a cardiovascular risk factor. So 40% reduction is substantial. And there's mechanistic studies as to why this is the case too. I mean, because the question is, great, I'm glad it's gone down, but why? And so actually it looks like it is the beta-hydroxybutyrate, which is that ketone body that is directly involved in decreasing inflammation in the body. So again, LDLP levels for most people will stay the same or decrease. They can increase for some temporarily, and for a few, if they rise and stay up, then that is a conversation, a risk conversation that you need to have with your individual physician. But for almost everyone, inflammation not only decreases, but decreases substantially with the start of a ketogenic diet.
Fun fact, beta-hydroxybutyrate is what we typically test for
That's
our
right.
finger stick ketone tests.
Yep. Beta-hydroxybutyrate is the main one that we look at. And again, seems to be the main driver in many of the effects from a ketogenic diet, mechanistically.
Okay, great. Is it okay to have alcohol if you're on a ketogenic diet?
Yes, and maybe. Yes, it's okay to have alcohol on a ketogenic diet. Maybe because it depends on what you're mixing it with. It depends on what your choice of alcohol actually is. So if your choice of alcohol is a big foo-foo drink with a lot of sugar in it, then no, that's not a great idea. But there's plenty of ways that you can enjoy an alcohol drink without introducing a lot of carbs. I mean, dry wines, for example, champagne, dry champagnes are an excellent choice. There are even beers now that are specifically low carb. And hard alcohol has no carbs in it. It's just that you need to be cautious of what you mix it in. So instead of a rum and Coke, a rum and Diet Coke could be the answer. So again, enjoy alcohol, but also we don't want to overdo it. I mean, what is the recommendation for the amount of alcohol on the ketogenic diet? No more than 1 drink a day for women and no more than 2 drinks a day for men. Just the same as it is for anyone who wouldn't be on a ketogenic diet.
I do happen to know we have a blog on what to drink on a ketogenic diet. If
Perfect.
You check that out
there you
on
go.
the Virta blog. Okay, next question. How do I respond to the statement, our brain needs sugar or glucose to function properly? And this goes back to what you said before. Go ahead.
About the ketone supplements, right? And that they're probably going to find their place.
And
Specifically with a
and gluconeogenesis.
And gluconeogenesis, that's right, okay. So ketone supplements directly here because I think there will be a place for them, as I said before, in brain health. Okay, people get this all the time. You know, you're going to get goofy if you don't have carbohydrates to feed your brain. You know, you're going to have problems thinking. You're going to be impaired, you know, in your work maybe that takes intense focus. And the answer is actually the total opposite to all those things, okay? So our brain needs carbohydrates to function when we're eating a lot of carbohydrates, okay? When we go and start a ketogenic diet and our ketone levels increase, our brains can get a big chunk of the energy they need directly from those ketones. And in fact, again, I'm going to bring back the brain health aspect of this again, is that it actually appears that the brain prefers to be fueled by ketones. And that's why I think it's going to be an important part of treating many neurologic diseases in the future. It already is a big part of treatment for some neurologic diseases such as epilepsy. So again, preferred fuel source, ketones. The brain still will need a little carbohydrate, but it's going to get plenty of that from gluconeogenesis, as Britt said. So your brain's going to be fed well. In fact, so many people report when they're on a ketogenic diet, focus increases, energy increases. They get rid of that carb fog that goes on, and they actually find themselves performing better. So this is not a concern for anyone on a ketogenic diet. But I understand that there may be questions, and that's how I would answer it. I'm just going to give you the one sentence quick answer to say to everyone. Brains prefer carbs when they're fed carbs. When they're fed fat instead of carbs, they love to have the ketones as an energy source, and any bit that they still need from glucose will be fed because the body will produce that glucose needed.
And can we say that those statements usually come from the first week or two of someone trying to adapt? There is a keto adaptation process.
Absolutely.
That can take up to 6 weeks or longer to fully feel the benefits. So that first week or so, yeah, you feel that little brain fog.
Right.
But that
it goes
subsides
away quickly and improves to functioning much better than you were before.
Absolutely. When is it okay to reduce insulin and anti-diabetic medications on a ketogenic diet?
When your physician says it's time. So once again, I can't say this enough. This is not something people should be doing on their own. There's so many things to consider. And what we really call this is de-prescribing, right? And so you need the help of a healthcare professional, preferably someone who's had experience in removing medications before, but this is absolutely not something someone should be doing on their own.
Okay. All right, next question. What can you do to make a keto rash go away?
So this is a good question, and keto rash, believe it or not, in all of the thousands of patients I've treated, I've never actually seen this. It's a pretty rare occurrence, but some people seem to have a skin sensitivity to ketones. And generally speaking, my recommendations on this is kind of the same thing that you would consider for eczema, which is maybe some over-the-counter steroid cream and lots of moisturizing. But oftentimes, people will see this dissipate over time. And again, it's incredibly rare.
Right, thanks. All right, if you're just joining us, we want to welcome you to Virta's Facebook Live with Dr. Sarah Hallberg. Please put your questions in the comment box below under this video. And to get notified of future Facebook Lives and other events, please follow Virta on Facebook. What can we do to help support a ketogenic diet and change the U.S. health guidelines? We are asking the perfect person for this. What can we do?
Yes, you can. I would suggest to everyone to go to the Nutrition Coalition website. So the Nutrition Coalition is a not-for-profit that takes no industry funding. So it is actually stands alone on organizations that are involved in nutrition and nutrition guidelines in this country, because all others take funding from industry. The Nutrition Coalition is strictly created to ensure that our national nutrition guidelines are based on rigorous science. So you can go to nutritioncoalition.us and you can sign up for our newsletter. Consider making a donation. The Nutrition Coalition has been started by a wonderful person named Nina Teicholz, and has had some major success in the past already. In 2015, we were able to ensure a passage through Congress of what was the first peer review of the dietary guidelines. Believe it or not, these have been put out for decades now, and they've never actually been peer reviewed, which is something that, of course, you have to do if you want to publish in the medical literature. So Congress passed a legislation that not only mandated that they be reviewed, but then also funded the review. The review of the dietary guidelines came out last September 2017. And if you Google that, National Academy of Medicine dietary guidelines, you can actually read the results of that review, which were that there is not solid scientific process in the creation of the guidelines. So again, the Nutrition Coalition is the place to go if you're interested, as we are, in seeing this change for the better.
Sounds like times are changing.
I think so.
Is a ketogenic diet appropriate for a person with kidney disease?
And so we always suggest that you consult with your personal physician before beginning a ketogenic diet when you have any health conditions at all. But I will tell you that I have treated numbers and numbers of patients who have kidney issues with the ketogenic diet, who have advanced kidney disease, who are on dialysis, who have had a kidney transplant, and many people with a single solitary kidney. So we have found that it has not been a problem for any of those people. But once again, this is something that is an individual medical decision and needs to be made with your individual physician.
Okay. Do you have any advice on how to avoid and overcome cravings? How to recover quickly from a day of bad eating?
This is a great question. Okay, so cravings. I mean, cravings are a problem, right? All of us, everyone has cravings. And so it's one of the big benefits, if you will, of following a ketogenic diet, as those elevated ketones really can help cut down on cravings. But when you're first starting on a ketogenic diet, they're still going to be there for a while. And so what can you do when you're beginning and you start to get those cravings? And that is look for something that is similar maybe to what you're craving that has a high proportion of fat in it, right? You're, really wanting something sweet. There's plenty of things that you can do with a higher content of fat to combat those cravings and still get that satisfaction. And again, you'll find that those cravings change over time. Not that you still won't crave, but the longer that you've been on a ketogenic diet, once you're fully adapted, the more you'll actually switch to craving things that are actually good for you. You'll have fat cravings. And so at the beginning, look for something that contains fat. Know that it's going to happen initially when you first start, but that those cravings will change over time. And then, are there any common ways to handle it if you have had a bad day? And the answer to that is yes. And these are really things that you need to prepare yourself for ahead of time. I can't stress that enough. Because let's just say you're going on a family vacation and you've got a family vacation spot that you go to and have for years now. And in that family vacation spot is the favorite ice cream place, right? And so you've made this decision ahead of time. You know what? I am going to be making a conscious choice ahead, not getting caught off guard, that I am going to go ahead and have maybe something much smaller than I would have had in the past, but I'm going to enjoy that with my family. How do you take that and keep it from then becoming, well, I might as well have a bad dinner, right? And then it's the next day, well, I blew it for the week, I might as well have a bad day. And so you've got to know ahead of time, conscious choice, and it stops there. The problem with this and the real risk of, well, I've had a bad meal, might as well have a bad day, might as well have a bad week, comes in when that initial time that you went off track was by surprise or out of an urge and not something planned. So plan ahead, and that can really help you police during these times.
But none of us are perfect.
None of us are ever perfect.
If you don't plan ahead and you get in that day where it's a really rough day and you fall off track, knowing what's going to happen is really helpful. I think knowing that it might set off more triggers for cravings,
Absolutely.
right? Because your blood sugar is now going up and down, and that's what sets it off. So you kind of have to like hop right back on the wagon, stop it as soon as possible.
Exactly, and do, just like we were saying at the beginning with the cravings initially, go back to say, what can I have now that has more fat in it? So you're really going to utilize some of those principles from the very early days right there and then again to help you get right back on track after a slip, because you're right, and I think that's a really important thing for everyone to know. You don't have to be perfect to be following a ketogenic diet, because no one is perfect. So again, it's learning and developing a whole closet full of strategies to help you out of that situations, not punishing yourself for not attaining that perfection.
And the health coach in me wants to say that an accountability buddy can be really helpful. Just somebody doing this with you that you can kind of report to so that you can get back on track. But I'll end there.
Absolutely.
Is nausea a normal symptom of a ketogenic diet? Are there any common ways to solve it?
Nausea is not a common problem with a ketogenic diet. So I would kind of go back to the same things that I talked about with the diarrhea. If you're having nausea, it might be that you're sensitive to something new that's come into your diet. So I would definitely, first thing, pause. What's new? What have I changed about my intake? And this is something actually that can come even from some artificial sweeteners. So try to take a look at individual things that have entered in to try to pinpoint what might be causing the nausea.
All right, what happens to cholesterol levels on a ketogenic diet, and generally do statin dosages typically change when in nutritional ketosis? And this is perfect as well because our own Dr. Hallberg here is a certified lipidologist.
Yes, and so cholesterol levels for most people improve. I'm going to go back and sort of repeat some of the things that I said with the LDLP question previously, and that is, again, for almost everyone, triglycerides dramatically decrease. HDL, or the good cholesterol, goes up significantly. And most people have either no change in their LDL levels or they even go down. That being said, I'll just say it one more time, there can be a temporary rise in LDLP or LDLC if you are losing a significant amount of weight, but that is a temporary rise. In those people, again, it's not as common, who do have a significant rise in their LDLP level. It's something that you want to talk to your physician about. Most people who begin a ketogenic diet on a statin medication won't need to increase their statin medication at all for a ketogenic diet. It will continue to keep your cholesterol in a good place as it had been doing. There are actually a couple of nice studies done on a ketogenic diet in patients who are statin treated. And what they find is that they don't have any disruptions in their cholesterol other than significant improvements in their triglycerides and HDL, which many studies, that triglyceride HDL ratio actually has been shown to be.
Have you had success with your patients who have lost large amounts of weight, having the flappy skin eventually going away without surgery?
Yeah, that's a great question, because this can be a problem for many. And there are a lot of factors here. You know, it's a factor of how much weight have you lost. And age actually has something to do with it as well, because younger people tend to be able to bounce back much quicker and get tightening in their skin again after a significant weight loss. So it is possible. But if you're one of the people who really struggle with this, and I got to tell you, it can be a really big problem for many people after weight loss. It can cause skin irritation, and it can even cause balance issues. So what I recommend is to start getting your problems with skin issues documented by your primary care physician. They can, number one, help you if there's any skin issues, and then that can help in the future if you really do need to have some skin removal done. So again, talk to your doctor about this one specifically. It definitely can improve in some, but the amount of weight lost and age play big factors in this.
Can you explain the cause of physiological insulin resistance?
Hey, it's $1 million question. I wish I could explain the exact cause of insulin resistance, but unfortunately no one can say for sure. Of course, there are many things that we do know, although the exact process and timeline of the development of insulin resistance is still uncertain. What are things that we know? Genetics play a role in this, okay? Genetics play a role in this, and even more concerning, probably something called epigenetics plays a role in this. And that means that we have genes, maybe possibly all of us have the genes to develop insulin resistance, but those genes get turned on in some people, but not in everyone. And factors such as what was the environment when a mother was pregnant probably play a big role in this. So again, genetics, definitely a big factor. Number 2 on this is what you were exposed to as a child as well. So in other words, it's very interesting, but beta cells of the pancreas, which are the cells that produce insulin, are a lot like the cells of the brain, meaning that they develop a lot when we are younger and then they stop developing. We're not growing new beta cells, just like we're not growing new brain cells when someone is older. That's all happening in childhood. And if in childhood someone is exposed to a lot of sugar, processed carbohydrates, young in life, what can happen to those beta cells is that they can hypertrophy, meaning they get bigger. And if your beta cells are bigger, even later in life, if you eat the exact same carbohydrates as someone who didn't have this problem, who has normal beta cell size, you're going to throw out more insulin. And so again, the higher levels of insulin around actually themselves, it is thought, are the key to creating that insulin resistance. Of course, again, with genetics playing a role. So genetics, early childhood exposures probably play a big role. And again, diet in early childhood is a big deal there. But again, even if you didn't have childhood exposures, if you're eating a lot of refined carbohydrates and once again increasing the insulin in general, that high level of insulin itself can be toxic to the beta cells. So it's probably not one of those answers. It's probably a combination. But again, once you have it, what can you do? Decrease and deal with the cause of it, not trying to band-aid it just with medication. Deal with the insulin resistance by allowing your body to need less insulin.
Yeah, the $1 million question.
Mm-hmm. Yeah.
Right. How can I avoid the keto flu when beginning a low-carb, high-fat lifestyle?
For most people, the key to this is just making sure that they are getting enough sodium. So when you start a ketogenic lifestyle, you actually diurese, which means you get rid of excess water. Because when we're eating a lot of carbohydrates, believe it or not, our kidneys hold on to sodium. And when we decrease those carbohydrates, our kidneys will excrete excess sodium. And that can actually cause people to become sodium depleted. And so it's important for people to increase the sodium, especially early on in a ketogenic diet, to ensure that this does not happen. Because if you excrete too much sodium, it can cause you to feel tired. It can even give some people headaches. And so again, increasing the sodium intake is important. Now, if you're someone with a history of high blood pressure, this is something that you want to talk to your physician about. Of course, the goal with a ketogenic diet for many people who come and start with high blood pressure is to be able to improve that blood pressure enough to be able to get off blood pressure medications. And that happens very frequently. Many trials have shown this, including our large clinical trial. But again, physician supervision, and making sure that you're getting enough sodium intake, especially early on.
And hydration. So
and
fluids
hydration
to go along
right.
with the sodium.
Fluids
that balance.
to go along. Mm-hmm.
How do triglycerides, LDL, and HDL typically change when on a ketogenic diet?
So I'll just review this quickly since we've answered this quite a bit before. But triglycerides generally drop dramatically. HDL, or good cholesterol, goes up significantly. And those two things lead to an improved triglyceride HDL ratio, which has been shown in many studies to be the most important cardiac risk factor. And again, those are the common changes we see with that. And again, triglycerides, HDL together are actually called atherogenic dyslipidemia. So if they're off, atherogenic dyslipidemia, which means atherosclerosis causing lipids, triglycerides and HDL can improve significantly. LDL cholesterol, again, for most people it doesn't change or decreases. There can be a temporary rise in some people with significant weight loss that then goes back to normal when the weight loss plateaus. But in the few people who have an elevated LDL cholesterol after their weight has plateaued, see your physician.
And a 2-to-1 ratio of triglycerides to HDL is pretty much considered a lower risk, right? And it's not uncommon to see HDL being higher than triglycerides.
There's nothing greater than sitting down with a patient and saying, you know what, your triglyceride HDL ratio is less than 1. Because believe it or not, we see people coming into the clinic all the time with triglyceride HDL ratios of 30, even 40. I mean, you wouldn't even believe that can have just this unbelievably dramatic change when starting a ketogenic diet.
If you're just joining us, we want to welcome you to the Virta Facebook Q&A with Dr. Sarah Hallberg. Please put your questions in the comments below this video. And to get notified of future Facebook Lives and events, follow us on Facebook. We have just about 10 minutes left, and with that, we'll get to as many questions as we can.
Great.
All right, how do electrolytes affect blood pressure when on a ketogenic diet?
Well, actually, that's a perfect timed question because it really goes to what we were just talking about earlier, which is sodium is actually an important electrolyte. I mean, we all need salt, okay? We have to have salt to function. And again, when you're eating a lot of carbohydrates, our kidneys will hold on to salt. And when you start a ketogenic diet, they will actually excrete it. So the kidneys are our regulator, if you will, of sodium in the body. And so if they're excreting it when someone is beginning a low carbohydrate lifestyle, we need to replace it. So again, that's why sodium is so important for most people, especially early on in a ketogenic diet. If you have a history of blood pressure, those are things that you want to talk to your personal physician about. But oftentimes, because of the sodium excretion, we see blood pressure can drop while on a ketogenic diet.
Here is one that I have been seeing a lot. Will a ketogenic diet alleviate neuropathy in the feet? So maybe we could talk about progression versus reversing versus...
Yeah, absolutely. So I will tell you there is no research done that shows that we can reverse neuropathy, diabetic neuropathy, with a ketogenic diet. Our real goal for people is to take away what was causing it to progress. In other words, halt the continued worsening of diabetic neuropathy. That being said, until we get research that can give us a much more clear answer in this area, we can definitely tell you of many patients that we have had who have had significant improvements in their neuropathy. I know, Britt, that you have your favorite story that really brought you some warm and fuzzies with a particular patient on this.
Well, my favorite story is at the beach when a patient shared with me that she could not feel the ocean for, I think, the last decade. And then one day she went and she felt the water on her feet again, and I cried right then and there. So it happens. But
it happens. But we like to make sure, again, one of the principles here is Virta is that we are a science-based company. And since this is an area where science is really lacking, we would never tell anyone, hey, if you start a ketogenic diet, your neuropathy will get better, because we just aren't sure of that right now. Our main goals here are certainly to keep it from getting worse.
Sure. So is a low-carb, high-fat plan beneficial to people with fatty liver?
Excellent. So we are going to be publishing a paper on this very soon. And so the quick answer is yes, okay? So fatty liver disease can be immensely helped for patients who are following a ketogenic diet. It's actually amazing just how common fatty liver disease is in this country and around the world. And it can be a big problem, leading to cirrhosis and even liver failure for many people. And so again, I will speak to the results of our large clinical trial, but we saw dramatic reductions in liver function tests in patients who were following a ketogenic diet for a year, and their fibrosis scores improved, and just kind of all around exciting results when it comes to fatty liver disease.
All right, we have time for one or two more questions.
Okay.
Is there hope that the low-carb, high-fat diet can reverse or halt diabetic chronic kidney disease? And we did touch upon this a little bit, so we can...
Yeah, and I would say yes, with some reservations. And here's what I mean. Hard science and mechanisms here, there's not enough science on. Let me tell you about our clinical trial. And our clinical trial, our patients, after a year on a ketogenic diet who had type 2 diabetes, so many of them began with some degree of chronic kidney disease, we saw a reduction in creatinine, which is one of the big kidney disease markers, actually even at 10 weeks, and then continued on to a year. This is an area where we want even more research to occur because we think that it is very likely that a ketogenic diet, which of course we know can be helpful in type 2 diabetes, could also be specifically geared towards helping people with chronic kidney disease of any kind. But once again, because I want to make sure that we are science first, the science here is lacking, other than there are numerous studies that do show that creatinine does improve on a ketogenic diet. We need to understand the mechanisms more, and one of the big thoughts is that improvement in inflammation we see from a ketogenic diet is playing a direct role in chronic kidney disease.
Okay. Is it normal to not feel hunger and sometimes not even wanting to eat on keto?
It is. It absolutely is. And the thing is, listen to your body on this. This is what we call now, the name for this is time-restricted feeding. Time-restricted feeding is when you're only going to eat during certain times of the day. And some people plan ahead and intentionally do that, but some people accidentally time-restrict feeding. And what do I mean by that? It means that they get up and they're actually not hungry till 11, and they listen to their body's cues, and so they don't eat until 11. And a lot of people come to me concerned. Do you think I'm not eating enough? Is it bad that I skipped that meal? Is it bad that I got distracted doing something or into a project at work and all of a sudden it was time to leave and lunch never occurred? And the answer is, don't worry about that. You'll be fine. We definitely do not recommend fasting intentionally for more than 16 hours a day. But if you accidentally skip a meal here and there, or maybe even regularly, great, because what that tells you is, number one, the ketogenic diet is really working on your hunger, which can be just something annoying to deal with. And two, congratulations, you're listening to your body's cues.
True. Thank you so much for joining us. To get more information, check out our research at virtahealth.com/research. You can also apply for our medically supervised diabetes reversal treatment at virtahealth.com.
Thanks everyone so much for joining us today. We look forward to doing this again so that we can answer even more questions. But the questions that were submitted today were excellent. Thank you.